Optimal function of the human body is critically dependent on the uninterrupted flow of blood circulating through the cardiovascular system. This is especially true for the brain, which can suffer irreparable damage within minutes. The severe restriction or complete cessation of blood flow to all or portions of the brain is referred to as a stroke. Every year, approximately 795,000 people in the United States suffer from strokes, and nearly 18% of these strokes result in death. Strokes have a range of impacts on the daily lives of those who survive them. Some stroke victims manage a full recovery, meaning they return to their lives with minimal modifications, which may include the addition of blood thinners or other medications to their morning routines, dietary changes, and perhaps an exercise program. For others, experiencing a stroke introduces varied and numerous severe long-term disabilities. When the blood supply to a region of the brain is interrupted or reduced, the brain tissue is deprived of oxygen and nutrients. In order to ensure that the nutrients in the bloodstream arrive at their intended destinations, the cardiovascular system has various built-in fail-safes intended to keep everything operating properly, including autoregulation and strategic design. Despite these safeguards, occasionally blood flow is still interrupted, resulting in a stroke. There are two types of strokes, ischemic strokes and hemorrhagic strokes. Ischemic strokes are caused by a loss of blood supply to the brain, typically due to the narrowing of the arteries. When the arteries become too narrow, blood may collect and form clots. Although clotting in the arteries, or occasionally the valves of the heart, accounts for most of the ischemic strokes, there are other possible causes. These include, but are not limited to, abuse of drugs, traumatic injury to the blood vessels of the neck, or blood clotting disorders. Hemorrhagic strokes are a result of bleeding in the brain due to the rupture of vessels within or near the brain. After a rupture, blood accumulates and compresses the surrounding brain tissue. Hypertension is the most common health condition shared by people at risk for incurring a hemorrhagic stroke, followed by cerebral cavernous malfunctions, atriovenous malformations, the use of blood-thinning medication, aneurysms, and bleeding disorders. Traumatic brain injuries may also cause a hemorrhagic stroke. Although approximately 13% of strokes are hemorrhagic, on average, they are fatal more often, accounting for 40% of the stroke-related deaths. A critical component to recovering from a stroke is early diagnosis and treatment. Therefore, it is vital that individuals have the ability to recognize the common indicators of a stroke and call for help swiftly. The most common signs of a stroke include visual impairments, anomalies in muscular behavior or sensation, trouble speaking, confusion, dizziness, or headaches. The acronym FAST stands for facial drooping, arm weakness, speech difficulties, and time to call emergency services. Face drooping is the first telltale sign of a stroke. This symptom may be a result of a block in either the right or left internal carotid arteries. Death to the tissue in this region fed by this artery often results in nerve damage, typically to the upper motor neuron of the facial nerve, which prevents this set of muscles from functioning properly. The nerve damage resulting in a characteristic facial droop may either be temporary or permanent. Arm weakness, often resulting from damage to the middle cerebral artery, is another characteristic of a stroke. One arm drifting downward is typically a sign that the converse hemisphere is suffering a problem. This symptom is often accompanied by a pins and needles sensation, which may be a result of damage to the dorsal column medial lemniscus system, or parietal lobe. S. The third letter of the acronym for the iconic symptoms of a stroke is an alteration to an individual's quality of speech. A layman should listen to identify whether the person is capable of speech or if a person's speech is slurred or unintelligible. Speech alterations in stroke victims are often a result of damage to the middle cerebral artery, which provides the bulk of the blood supply to the cortical areas involved in speech, language, and swallowing. Specifically, the left middle cerebral artery supplies Broca's area, Wernicke's area, Heschel's gyrus, and the angular gyrus. T, which stands for time, is the final letter of the acronym used for diagnosis of a potential stroke, is the beginning stage of the immediate action needed in the intervention and treatment for stroke victims. Recommendations suggest that if any of the symptoms mentioned a priori are present, even if they resolve themselves, 911 should be contacted and the individual should be transported to the hospital. One of the most dangerous conditions sustained by a stroke survivor is damage to the medulla oblongata. The damage is marked by swallowing problems or dysphagia. One role of a speech pathologist after a stroke may be to assess the swallowing safety of an individual. Another role of the speech pathologist may be to improve language and speech abilities. Language is dispersed throughout the brain, but is primarily concentrated in the left hemisphere and in the perisylvian region. Difficulty producing words, slurred speech, loss of speech, or difficulty understanding are common after damage to these regions. The speech pathologist may offer a variety of interventions to address the specific individual's needs.
Before my dad had his stroke, he was very active, very involved in the community, the guy that anybody would come to when they had a problem, when they needed something fixed. He was always a mechanic, always very good with his hands. And he was just really present and involved. In 1987, my dad had bifemoral, bilateral, arterial replacement. I think that's the right terms. They had to put stents and replace part of the arteries in both of his legs from after being a pack-a-day smoker since he was 12 and not having the best eating habits. It caused major blockages in his arteries, so it caused him to not be able to walk very far, and he was short of breath a lot. So he had that replacement done in 1987. And unfortunately, because he didn't change his lifestyle, he had the same surgery done, but only on the left, I believe, in 1994. In 2004, my dad had an ischemic stroke. I think that's what you call it. He had a clot in his left carotid artery that let loose and obviously traveled to his brain. Following his stroke, he lost control of his emotions. They described it as the pseudo-Bulber effect. He no longer could control when he had an emotional response. So even though he would tell himself, like, don't cry, even just sweet commercials that would come on TV with a little dog or something, and he would just be sobbing. And it caused a lot of dramatic effect for him because he knew that that was an inappropriate emotional response, and he could tell that that was against what he wanted to be doing. But he couldn't control it. And so it was a really interesting time as he tried to grapple with being a different person. And truly, my mom described it as one day she'd been married to someone for 45 years, and following the stroke, she woke up and was married to a completely different person. Following the stroke, my dad had mobility challenges. He lost the ability to use his left leg like he wanted. He could still walk, but he had a very pronounced limp and oftentimes had to use a cane. He also lost the ability to control his left hand, which was significant because he had always been very mechanically inclined. He was the guy that if he didn't have a tool, he made a tool. And he could no longer use that function. He couldn't make his hand do the things that he wanted to do. And so he really lost the ability to do things that he had loved for a very long time, including sailing. He could no longer pull ropes in order to sail, and that was significant. But he also lost the ability to control the things that came out of his mouth. So he would say things, anything that came into his head would come out of his mouth, and sometimes I think he knew what he was saying was inappropriate, but he just didn't have the ability to control it. We always said he just lost his filter. So whatever he thought is what came out of his mouth. Following the stroke, my dad was offered a number of services, including occupational therapy. He did a lot of physical therapy. They worked with him in trying to get his body to work as best that it could. He went into a rehab facility for about 3 months immediately following the stroke. And then prior to coming home, they sent someone out to help make sure that the house was ready for him, and so that it had paths cleared for him, because he used a walker for quite a period of time immediately following the stroke, and then into a cane. But I think primarily the most beneficial for him was the physical therapy. Prior to his stroke, my dad was very active and he sailed extensively and often alone. So he took his 45-foot sailboat. He sailed from Santa Barbara to Mexico alone. And about a week before he actually had the stroke, he felt like there was something calling him. He needed to come home, that he didn't really have an explanation for it. He just felt like he needed to. So he actually left his boat in a harbor in Mexico and took a train all the way home, and within days he had his stroke. And we've often thought about what would have happened, or what could have happened had he stayed on the boat and taken off sailing and been out alone in Mexico sailing instead of at home where he could get treatment.
Every 40 seconds, an American has a stroke. Although there are many risk factors over which we have no control, including but not limited to age, gender, and race, there are many things an individual can do to lower the probability that they will experience a stroke. Controllable risk factors including reducing hypertension, eliminating tobacco consumption, and managing weight. Most importantly, understanding the basic mechanics of our neurological systems and how symptoms of stroke may manifest, the long-term effects and general impacts can be minimized by early intervention and evidence-based practice.